Good afternoon, everyone. My name is Keith Whalen from RPI Consultants. I want to thank you for taking the time to attend today's webinar on occupational health and safety management. This is specific to Global HR and version 11. This is actually a webinar that was requested. Shout out to Joe McDevitt. And for the rest of you out there, if you have other ideas that you'd like to see, please put them out there. We do listen and try to put together content that is useful to our audience. Hopefully you'll find this very informative. And without further ado, I give you Jackie Dudas, Melissa Olson.
Thank you, Keith. So like Keith said, we're going to be going over occupational health and safety management, which are actually two separate modules within Global HR. In S3, they're kind of bundled into one screen. Here, they're two separate modules, so you can use them separately, or there's a little bit of integration between the two, so you can also use them together.
And they are part of Global HR out of the box. They're not an ancillary talent management module that you would have to license separately. They come as part of core GHR. Okay, so a little bit about us. We are a full-service Infor Lawson partner, implementation, upgrade, installation, process re-engineering, any Lawson needs you may have, Infor Lawson needs you may have, we can help with. We are based out of Baltimore, but we have consultants all over the U.S., and so there's somebody probably right in your neighborhood, neck of the woods.
Here's our agenda for today. We're going to go over OC Health first and then get into safety management a little bit. Reporting, we actually ended up breaking that out and talking about it throughout the presentation, so you'll hear about that this whole time. So health and safety management overview. When you log into Global HR, the canvas, you'll have two separate icons. Actually it's one icon, it's health and safety, and then you open it up, and from there you have these two separate buttons to take you to each of those places. A lot of the setup is kind of shared between the two modules, like locations, facility managers, that is all shared. So that's why it's in one place, and then the setup is shared here. So you'd set them up for either module or for both module, and then you're able to use them in both places. This is the process board for the health and safety administrator. So when you open it up, you have each of the icons. If you want to add a new incident, any of the reports, adding a health assignment to somebody, and then tracking your safety incidents and an observation log there. Additional roles here. So these are the standard delivered roles in GHR. Again, you can make additional security roles if you need them, but this is what comes delivered. So you have the OC Health Administrator. So this is who sets up the codes. They really set up the system for you to use. They set up the facility health managers. They can create the email templates and any kind of notifications. They're going to set all that up to begin with. And then we have the facility health administrator. This is someone who is in charge of a specific facility or location, and they're going to be able to update those codes, update some of the templates, track some of the components that are assigned to employees, track safety incidents, just kind of manage the facility or the location that they're assigned to. We also have managers, so if you're a manager and you log in, you can see your direct reports health components. You can see if something is pending or completed, or you can assign a component to them. So if you have a new hire and you want to assign that they need to get their flu shot before they start or some other vaccine, you can assign that through manager space for them to see. And then as an employee, when you log into employee space, you have the option to respond to your health requirements. So if Melissa assigns to me that I need to get a flu shot, I can accept it or reject it and suffer the consequences. Yep. So you have those options in there. If you want to allow them to respond, they can respond to those health requirements. And then they can also complete a requirement. So once I get that flu shot, I can go in there and say that it's complete and upload a document to provide proof of that completion as well. So here's a screen for the setup. So again, this is the initial screen we saw before, the process board for health and safety management. I just clicked on setup here. So these are some of the main components that you need to get going before you can actually use the system. There's a little bit of organization configuration, which I think is my next slide. Here we go. So this is a lot about your emails and your notifications, when you want an email to go out and who you want to get notified. So based on certain things or incidents or components that happen, you can set up whether a notification happens, whether an email goes out, and then you can assign a template that you've created to this to this notification. We also have, so this is for safety, we also have it for health at the top, any kind of alerts, and then here's some of your OSHA reports up here and health history reports. So if you're tracking history on an employee's health components, that'll live right here too.
And yeah, for the OSHA reports, we'll go into that a little further when we get into safety, but depending on which OSHA report that you need to submit, you would be able to set up those templates right there for the organization.
Back to our setup, locations is right here. This is actually going to pull from your HR structure location. So any location that you've added to the system there is going to be available here. You can add additional ones as well, but just know that that's going to communicate with your GHR structure, like HR locations. So you're going to use those to assign treatment facilities or places where someone can go to get a treatment or a shot or something. And then you can also kind of create those, you can set the location as a treatment facility on this treatment facilities button. Here within Occ Health and Safety, there's a few more items I think we'll get to in a couple slides, but those are the components that are specific to those two modules, whereas this org configuration and the location and facilities, that is above it all. It communicates with both modules.
Being able to use for both, right?
Yeah. So here's our location right here. So this is a location that already exists in the system. Here's a location manager for it. So a location manager is someone who's going to be able to track all the health components that are pushed out through this location or this healthcare treatment facility. They can set up email templates or appointment notifications for if Melissa assigns that I need to get this flu shot done, she assigns me to a location, that location manager can view and access my health component at that location. You can see here, this is a lot of information that you can track on a health facility. You have the address information here, contact information, and then for a location manager, you have both the access for health and or safety here. So if I was managing this location and I was both the health administrator and the safety administrator, you just select both of those there, and then I have access to view both of those components for employees or all resources.
And the locations for the safety side wouldn't necessarily, they could be the treatment locations, but a lot of times it's the location where the safety incident occurred or where the safe behavior was observed or the non-safe behavior was observed. So think about that when you're thinking of your locations. Facilities may be good for the overall for health, but if maybe you have a clean room in a certain facility that you want, that there might be a lot of incidents or safety behaviors observed, you might want to pull that out and create a location specifically to that room, or outside, an area outside that there are constantly some incidents occurring.
Couple more Occ Health setup items here. Date calculation methods. So you have the opportunity to set up infinity date calculation methods, and this is where you would tie to an employee health component assignment when it's due, when it expires, when it's up for renewal. So these are, I have a screenshot coming up maybe next. It's easier to explain if you can see it. We'll come back to it. But you assign that when you assign it to the employee. You can default it from the health component itself, or you can override it at the employee level to tell them when they need to have it done by. And that's driven off certain dates within the system, like component assignment date, hire date, adjusted hire date. Component type, so this is where you define a grouping for some components. So if a vaccine is, if a flu shot is in there, it's going to be the type of vaccine. So any vaccine that you would get, whether it's chicken pox or the flu shot or anything, that would all be under the type. So just kind of a category or a grouping for you to categorize those and run reports with them. Injection sites, that's just where you track where on the body you've done an injection. So mostly, left arm, right arm, thigh, kind of thing. You can define all of those yourself.
So wait, that's not where you actually go to get your injections?
No, that's the facility.
Okay.
That's the treatment facility. This is the actual, in case there's some sort of reaction to the shot, you need to track where the injection actually took place. This is the actual spot on your body. Again, it is user defined, so if you wanted to make it something else, you could do that, but the point of it is like right arm, left arm sort of thing. Health components, this is where you actually define what is happening. So flu shot, again, that's my go-to example, but that's what this is where I would define the flu shot. It can also be like an annual physical or a vision test or anything to that effect.
Drug test.
Drug test, exactly. You go in here and define that. A health series is a series of components. So that's if you want to make a whole annual requirement list series, it'll be like physical, visual, drug test, flu shot. You can combine those into a series and one will follow the other. As they're completed, the next one will get assigned. Appointments, this is something that you can create for across the board. So like maybe just a generic appointment template, and then you can specify it when you get to the employee where they're going, what the appointment's for.
And a lot of times companies bring on site some company to do blood screens or drug screens. So if your company has that and you want to get appointments for everybody who needs one, you can set them up here and then the clinician shows up and is able, you can track it, make sure everybody attends.
Positions here is, this will take you to the screen where you can set up positions, but the occupational health manager won't really have that access, but it's the same kind of screen, and it's where you can tie the health components to a position. So if I'm in a nursing position and I really need to have some vaccines or some requirements before I can start that job, I'm going to tie all those health components or those series to that position, and then you can see where that gap is between the resource and their position requirements if necessary. Email templates go out for appointments, for when you assign health components. This is where you build that setup, and you can use the variables to show what needs to be completed in that section. And clinicians, this is where you pull from your resource records. You can assign someone as a clinician, someone who would be administering the health component. Okay, so here's an example health component. This is the flu vaccine. There's a lot of information that can be tracked on here. So this is just the initial screen. You can see it's a health type of vaccine. The result type is either positive or negative or completion. Here I have a due date calculation 1 month after component assignment date. So I'm saying is within the month after Melissa has told me that I have to get this, I must get it done, or else I'll get pestered with these email templates.
Or removed from the job in some cases,
Exactly.
like if you are in healthcare on a floor with patients.
Yep, and you can run reports to see who is out of compliance and needs to actually get those health components completed. So the due date calculation is the only one that's necessary, but if you also want to add an expiration date or a renewal date calculation, you can process or create those and then add those in here. And then for this one, I'm saying that documentation is required for completion. So I want to see proof that the flu shot was given to me. And you can also say clinician required. So if you want it to be someone within your own organization, you can specify that here. Over here we have the lot number tab. So if you are tracking a lot number for that year's vaccination, you can track it here. You can add multiple lot numbers for each year. So this is my one component here. This is going to stay here forever. Then I'm just going to pick the specific lot numbers for each year or each release of that vaccine. Here's the due date calculation. So this is all, you create all of this except for down here your date options. These are delivered, and this is what you can choose to drive the due date off of. So you have completion date, so when it was completed, or completion date of previous, if it's in a series, you want to complete it off of the last time it was a component was completed. Component assignment date, so that's, Melissa assigns this to me, I have a month to get it done. Start date, adjusted start date, these are all the HR 11 or resource record dates in here that we know. And then you specify the units and the duration, so before, after, and then months, days, weeks, years. This is where you would set up a health series. So again, this is my annual requirement series. I have the vaccine, a physical exam, a visual examination. And you just specify one after the other here, and then you can also specify the expiration date and what the outcome is. So the outcome for the next one would be, outcome for the flu vac would be the annual physical exam. Appointment setup. So you can create predefined appointments, so that's where you're creating it kind of for the organization, and then once you push it down to the individual appointment level, you can specify dates, times. You can also just create an individual appointment on the actual resource record. You can assign a health component there and assign an appointment to them there. You can do an all-employee appointment, so like Melissa was saying, if you bring in a certain provider and you want to push it out to everybody, you can do that as well. And a single employee appointment, that's the individual employment appointment again there. So this is your appointment that you'd create here. Here's the name of it. You can default a location in, a start and end date, approximate duration, and then the location right here. And this will get sent out to the employee with one of those appointment templates that you've created. This is a view of the position screen. So here's my list of positions over here, and you can assign health components to those positions that are specific to the environment in which that person works. So for this staff nurse, I've just selected the annual requirements under their occupational health requirements here. And you can assign both components and series to them. So a whole list of them or just one at a time. Here is a view of an email template. So again, this is you're defining all of this. Up at the top, I just have an appointment template. And then when you right click in here, these are the variables that you can see. So I've used variables to kind of build out this email template here, hello, employee first name. It's gonna pull that off of their record and send it to them. So you can also do that for the health component. So you don't have to go in there and actually type, it's time for your flu vaccine. It'll pull that right off the record when you're creating that health component assignment for them.
And these are the same templates, so I didn't do the screen again. These are the same templates that you're going to be using on the safety incident. So if there is an incident that's been reported and you want to send an email to either somebody who's observing, if you're assigning somebody to go out and investigate, you can create all those email templates here that are triggered based on the incident or the behavior.
It just says health at the top, but on the screens it'll say safety, but it's the exact same setup.
Yes, same place that you would go, and you would just create your template. You would hit that drop down and you would have options for safety ones as well.
Here's your clinician screen. So I've just expanded that clinician screen up there, or button at the top, and you can see it's your list of resources. So you need to choose someone that's already in the system. If it's not an employee, it's a clinician that just comes in and visits, you're gonna have to add them as a resource record. You don't have to track that much information on them, just get their name in here, and then you can assign them as a clinician for your health components.
And that's a great reminder that you don't have to necessarily have employees in your system. These are people records. They can be contractors. They could be just somebody that comes in one time to do, or maybe once a year to do these types of flu shots or vaccines or whatever it may be, and you can track them in there without necessarily having to move them over to your payroll or any of those other batch processing programs.
Here we have a manager view of occupational health. So if you as a manager want to know what it looks like when you go in and view your direct reports, my direct report in the system is Lisa. So under my staff, this is her name right here. I would see her position description right here under her name. And then over on the right-hand side, I can see health components that were assigned to her. She is way overdue on some of these. Over there on the health record side would be any history that is tracked on her once she completes them. And then the appointments, if she has appointments to get these actually done, I can view that to see when she's scheduled to get that done. And then for the, employee view is next. So me as an employee, I log in to see my health components. I can see I'm overdue on something too, 2013, pretty late. But these are what I need to get done. And once I've completed it, I can go ahead and click this complete button up here, and it's going to notify my manager that I think I'm done with this and that I'm in compliance with my position or with the organization. Again, appointments up here, I can see if I have any appointments, and then any previous health records that I've submitted to the company will be tracked here too. So a little bit of integration between the two systems. This is going to be my handoff to Melissa for the safety management part. But within health and safety, if the integration exists when a safety incident occurs, maybe you get a needle stick or you're a fluid exposure, you can use a follow-up task to add a health component. So if I get a needle stick or a splash in the eye, I can fill out a follow-up task for a health component that I need to then complete. So as I'm creating this incident, I'm going to say, fluid to the eye, need to get a vision exam to make sure everything's still okay. You assign that to the employee. You still have your due date calculations on there. And that way you are tracking what is happening in the system to make sure that we're taking care of that incident or anything else that happens at your organization, to make sure that there is follow-up to ensure that everybody's health is okay.
Right. And I think that can also be used as a workers' comp kind of component. Anything that the treatment, all of those things that you want to log for any workers' comp claims can be tracked in here as well. I think we do have a question. I don't know if we want to hit
It's
that
about
at the
health,
end.
so do you want to hit it at the end or do you want to come back to it? Let's see.
We can-
Can complex health conditions be evaluated? For example, can a TB screening be overridden by X-ray history review and symptom review? Okay, so this question is, if you're getting a TB screening, there's multiple ways to confirm whether you can do like the PAP, I forget what it's called, the needle test where you get the needle in your arm and if a bump appears you have TB, or you can do the chest x-ray. So the question is, can you do one or the other kind of thing? You have to set them all up as health components. And I've actually just kind of went through this with a client trying to figure out how we track this for someone. What if they had the PPD in the past and then now they're doing the chest x-ray because they were a positive PPD before. How do you actually track that? Which one do you assign at this point? So that's going to be more at the employee level. You're going to have to look at their previous health records and figure out if they have had that positive PPD, you then need to assign the chest x-ray instead. So I would probably recommend that you set them up as one type, like a TB type or a TB series, and assign those different types of approval components to it. And then when they complete one, then you can kind of maybe set up something to auto-complete the others. Or if you assign like the type to them, they can complete the whole type. But then you'd have to add comments to make sure you knew which was actually being done, whether it was the chest x-ray or the PPD or whatever other options you have out there. Can you move the little GoToMeeting thing? We got one more question. Caraflow has scanners and UL's OHM product uses an iPad. Is there a mobile app to capture and track employee flu shots with Infor's solution? Not that I know of. I know that Infor does have mobile capability, but I don't think they have any kind of interface with this yet. That being said, there's a lot of customization available to you here, so not sure about the mobile part of it, but that might be something that they're looking towards in the future.
And we can look into that and talk to one of our developers about seeing what might be able to be done with the configuration console to make it mobile.
And a follow-up question, will Caraflow work with this? I've actually never seen Caraflow, but we will follow up and let you know if it will. Is there a facility near us in Greensboro, North Carolina that uses this that we could visit? If you're in Greensboro, North Carolina, and you use this, let us know, and we will answer this question.
And we can also
We'll do
reach
some
out
research.
to Infor and see what clients are live with it.
Oh, okay.
Yeah. So.
Are they live with it? I'm not sure. Yeah.
We'll find out.
Yeah.
All right, I think that's it for the questions for now, but please continue the questions.
Okay, so now over to safety management. So again, we were kind of talking about S3 Lawson had very limited capabilities in tracking safety incidents. You could put them, but there was not a lot of follow-up or approval flow, well, not so much approval flows, but like those templates that say, okay, this has happened, what needs to happen next in the observation and investigation of any kind of safety incidents. So the safety incident or management portion of this module will allow you to track all of those incidents, whether they be tracked by somebody in HR, a manager can report them, or an employee can report them themselves through their self-service or spaces areas. You can, if there is a large incident where multiple people are involved in this incident, you are able to track the incident as a whole, as well as each of the employees that were affected with this incident. And if there were non-employees that were affected, you can track and follow up on them. I know, I don't know, but I think, lawsuits can arise from things like that, and you need to capture as much information as you need to. And this does allow you to capture any kind of people that are not your resources that are affected by this incident, incident. You're able to track the costs surrounding the incident, whether they be physical costs or employee treatment type costs. The investigations around the incident are able to be tracked in here. And then, as you see, there's a lot of different reporting that can come from here based on, the incident itself, observations, safety behaviors, all of those types of things. And I just lost my hat. Now I can see you said somebody else yesterday was taking theirs off. I can see why. So there's a lot more reporting that you're able to get to, as well as regulatory reporting for OSHA that you're able to get out of the box, which you didn't have in S3. In S3, you had to kind of pull together some things with Excel spreadsheets and find your data in multiple sources.
Speaking of Excel spreadsheets, I see we have 2 more questions. Just going to take them real quick before we get too far into safety. Can we import records from Agility and other employee health systems into the system? And the other question is pretty similar. Is there a mass entry portal? So right now there are no conversion programs for health and safety. However, you can use Enforce Spreadsheet Designer to upload these records into the system for these resources. So if you're able to export it from your other system and maybe do a little bit of formatting, you can import it via upload to health and safety management.
And then for that import from Agility or other employee health systems, you can use IPA to do an interface and basically take the data points that you need from your tracking systems and drop them into the occupational health management. If anybody here had attended our last webinar at 11, we were talking about getting all of your employee information in one place, your system of record. So whether you use third-party vendors to track other things, whether you use spreadsheets or access databases, it's fine to do them elsewhere. But if you can track components so you have an overall snapshot of your employee in one place, that's really where you want to get to when you have a HRIS as your system of record. Okay, so safety, you're able to you're able to track a bunch of different things. In the setup, you would be able to create what are your accident types. So all of those incidents that you may have, what are the big ones that generally you have to track costs and things. So, and you can have the small ones too, but we put the big ones, the ones that really impact a lot of people, which are, fires and chemical spills, healthcare, a lot of needle stick accidents could occur. And obviously, if you are in areas with heavy lifting, if there's some sort of back injuries that are occurring all of the time, slips, falls, where you start seeing patterns, you would create accident types for those. The severity codes, whether they are life-threatening or minor. And then the actual injury, so injection site, where it's happening. So somebody was in a motor vehicle accident, what happened to them as a result of this accident? And hopefully it's nothing terrible, but if it is, you do have the option to create a code for every type of injury that would occur. Safety behavior categories. So this is where good or bad people are able to observe behaviors that are occurring at the workplace and report them. So as an employee, I could say, and I'll get into this in another slide, I see that my employee Ken is doing the proper utilization of a ladder and doing everything safe around using that ladder, or vice versa. Well, again, we'll have an example in a little while, but if they're wanting to report a behavior that somebody is constantly doing that could could result in an accident, you want to know that. So if there needs to be some sort of safety training, maybe everybody went through it when they were going through orientation, but it's been 3 or 4 years, and you realize maybe we need to do this safety training on a yearly basis because people are still having these accidents. That you can start seeing those patterns through these behavior, people being able to observe the behavior and report on that. So the categories, handrail use, safe work areas, any kind of thing that is around your workplace that is considered a safe behavior. Again, all of these are examples. They're not in the system. You would define them yourself. Causal factors. So what are the things that caused either the incident or some of the things that could cause the good behavior. You know, if there's proper training, or if there was no training at all on how to use a certain piece of equipment, that would have been a causal factor in somebody getting injured with that piece of equipment. You know, some working environment, you know, we see a lot. I live in California, and there's a lot of wildfires, and there's definitely high risk for firefighters to get smoke inhalation injuries. You know, it's just a working environment.
Or ice on the sidewalk.
Ice on the sidewalk. So there are just different areas in the working environment that you know could cause injury, and if you have the safety training around it and the proper ways to deal with those situations, then you can mitigate some of those injuries or accidents. And then finally, you can set up your treatment facilities hand in hand with the occupational health. If they're already set up for occupational health, you just borrow the ones that are set up. If you're not using occupational health, or potentially you have other facilities that treat injuries that are outside of what, you know, the regular diagnostic tests that you're taking for the occupational health side, then you would set them up under treatment facilities. Okay. Okay, so back office, you've got two roles. You have a safety administrator and a facility safety manager. So the safety administrator will assign managers for all of the locations. So the safety administrator has actually just all the access to any type of screen that you need. And the difference between the two of them is facility safety manager will only have access to update incidents and observations for their location specifically. Or you can assign them multiple locations if you need somebody for one certain area of like 3 facilities, and the safety administrator would have all. If you have 10 facilities, they would manage all of those. So they would be able to report any of those safety incidents. They would be able to evaluate any of the observations coming from these incidents. They could assign investigators to them. They would process any of these incidents, and then any kind of follow-ups that come from the incidents. Both of these roles would be able to do. Again, the only difference is if you want to limit it to a specific set of facilities or specific set of employees, you would give the facility safety manager role to that person. For your, sorry, some of these little gifts I can't look at without laughing. So the manager, so you'll have an end user role. That's the safety dance. That is not the safety dance.
That's an incident.
That is definite incident. Drunk Santa. If you have Santa Clauses that you have working for you doing the bell or whatever, you do not want this happening. Then sober Santa. So managers are able to report any observations for the employees that are either directly reporting to them, or if they happen to see another employee, they're able to report those observations. And this is the role out of the box that the manager will be able to get if you open up the safety management module. They can report anything that might affect their employees. They're able to validate any of those safe behaviors that we were talking about before. So, you know, maybe there is some sort of recognition program for people who are constantly abiding by those safe behavior training methods. And if they need to be assigned as an investigator for a specific incident, a safety admin or safety manager can assign them as an investigator. And then they're able to perform any of those follow-up tasks. So if there's something in their area that caused the incident, they would be responsible for possibly cleaning up the incident, making sure that it doesn't happen again. So they would fix a faulty, stair or handrail that's missing. If they're responsible for getting that taken care of at their facility, the manager would be able to perform those tasks that are assigned to them.
And also verify that maybe a health component was completed as part of a follow-up.
Right. Okay, so the employee. So same thing. If the employee is able to see any safe behaviors or unsafe behaviors, they are able to report it through the employee space safety area. They can report injuries to themselves. If this was to happen, it would go through to their manager to validate that did in fact occur to them on work property during work hours. or if it's, a company vehicle or whatever it may be that the injury did occur at work. And then they're able to input any kind of observation records that were requested of them. So say there was an incident, and I'm going to show you what the screen looks like that. So there's a big incident that happens, a fire or a chemical explosion, something like that, large, that happens, that a bunch of people were at. You'll want to get the information and observation from all the people that were there to see what could have caused the incident or accident. So you, as a safety administrator, can assign observations to all of the employees who are present so they can go in and put their observation records, what happened before the accident or incident occurred. And they're able also to do some investigations if they're assigned that role, and same thing, provide any kind of follow-up to or treatment to accident or incident. So some of the templates that are out of the box are going to be your 3 OSHA reports. They're available. You just set them up for whichever you need to file. There are generic incident reports, so you can set up a template based on your organization. If there are generally only health-related type of incidents that happen, or if there are fire type of incidents, you can create. And hopefully you don't have a lot of fire incidents. But if you have the same sort of incidents occurring over and over, you can create the template with most of the information filled out with just, the date it happened and the employee it happened to and the details that are left open to kind of save some time and also to help out with managers or employees who submit their own incidents. They can select from a template of what occurred to them, and it has the correct information on there. Email, you saw through Jackie's slides on the health side that you can set up those email templates. The types that you could set up for the safety module are email templates based around observations and based around the incidents. And there is an alerts panel that you can set up a certain amount of days that an observation has to come back to you within a certain amount of time, and if it has not come back, that means you need to escalate it and go back to that employee and say, hey, I assigned you an observation, we're investigating this accident, you haven't responded, we need to close this case. So this will give you that alert that somebody has not responded to an observation request. Okay, so here's your observation log. This is on the back office. Your safety administrator would be able to have access to this and be able to fill out these observations. If they were to fill out themselves, and this is very similar to what an employee or a manager would fill out as well, what are the details to this observation, whether it's safe or unsafe. This dude over here is standing on some stair rails.
I'm so glad that's not a gift of pinfall.
I know. I didn't want to put anything that, I hate watching like those shows of the fails where people are like hurting themselves. Oh, I can't stand watching, so I did not want to put any gifts for you guys of people hurting themselves. If this was my husband doing this, he would probably totally put all those like Jack A types of stuff. Anyway, you would put here, this guy is not using a ladder to hang the banner. The observation, it's a near miss incident. So he didn't end up falling. We'll just say he didn't end up falling. But this is bad behavior. If this is the way he does this every quarter, he's going to fall one of these times. The data was reported. Who's the one that observed it? So if it's the safety administrator, they would take the employee who is calling in the observation. They would take their information. It would auto-populate if you're doing this in employee or manager space. So Tom is the one that's doing this. I'm the one that observed him doing this incorrect behavior and snapped it with my picture, and then probably attach, snap of what he's doing wrong or a video, because that video might make it to YouTube. But we will, and then the observation date. And if there is a time, if you know exactly the time that it occurred, you would put that there. If not, you have an option here that the time is undetermined, but you could put in the shift or what time of day, just kind of limit it. If it was an accident, you do kind of need all of that information for the investigation. And then you also have a more detailed description. I didn't put a screenshot of all of that, but it is a free form, so you can put the whole story leading up to whatever the observation was. The location it occurred at, and this is kind of what I was talking about earlier. You may have a whole facility as your location, but if I wanted to say, break room, cafeteria, wherever he is, you can create smaller locations for the investigation purposes. It's kind of hard to do an investigation if it's the whole building or facility, but if you have it limited into what area it was, it'll be a little easier to find those causal factors. And then any attachments like YouTube video of Tom over here falling and, doing whatever he does safely or unsafely. And then as a safety administrator, I would be able to see a log down here, a log of all of the incidents. So here's a new one. Tom is going to show up right in the front of my log. I could see in here the input requested, which are other observations that either a facility safety manager or the safety administrator has gone out and requested some more observations around that. So these are things that are kind of pending, waiting to hear those observations again. Any of the incidents or accidents that are in review will show up in this tab, all of the active ones, and then you've got the historical incidents. So you can see everything that's happened. If you need to report on for the year or for the quarter, you would be doing the reporting out of here if you're not using one of the stock reports. This is a safety incident here. Again, the last one was just kind of an observation. This is when something actually happens, like Shaq gets smashed by a tree that somebody didn't properly put up in the studio. Yeah. Oh, somebody did push it over. Oh man,
Employee relations.
And see, now I need to figure out who saw that guy's face. So I would put a request for an observation out there. But this could also be for those larger ones. So if there is a fire that affects 30 people, I want to know, the employee cases, the non-employee cases, if I have any follow-up attachments. So maybe there's health or hospital records, anything that comes from that accident that would go into either the investigation or be supporting for any kind of lawsuits or anything could show up in this accident attachments area. All of the follow-up actions. So they could be follow-up actions for the employees that were injured, as well as follow-up actions to make sure that this does not occur again or the fire does not occur again. The causal assessment, if you've determined, that it was training that somebody didn't have, and that is why something blew up, then that's, you would put that as the causal assessment. And then the cost. This was where you could go down and figure out, if there's costs associated with the employee, health costs, medical costs, and then the location itself. If there was a fire, what are the costs associated with rebuilding and everything that was lost in that accident? So you've got a lot of information that you're able to be able to report on and track. That request of observation input down there, that is under the observations. This is where I'm going to go ask that dude, or go ask everybody, who is that dude that's sitting, that pushed the tree over? So as soon as I assign it to them, it shows up in their employee space that they've been requested to put in an observation report about that accident. Okay, and then just some of the reports that we've got out of the safety. I'm not going to go through all of them, but just the reports that generally everybody has to do, the days without incident, any kind of analysis on specific incidents where medical costs may have been involved, if it's on a specific employee and you need to report on that, maybe all of your causal where it's training is the reason for this incident. All of these incidents you'll see, wow, we've got 10 incidents that it was because they weren't trained on a piece of equipment. Maybe we need to do some training. So you've got a lot of, and the good stuff, let's be optimistic here, all the safe behavior analysis as well. So you can push your employees to not only report safety behavior near misses, but also where things are going well. So you can kind of promote that safe workplace mentality and recognize it. So it's kind of some of the reporting there.
That is it.
And yeah.
We do have a couple questions, so let's hit those real quick. While we're talking about safety, can you upload a photo or videos to safety observation? So when you first set up Global HR in the organization setup, actually pre-organization, like when you're setting up your enterprise company, you specify the size, the maximum size of attachments that you allow. So you'll have to look there if maybe for some reason it's not getting uploaded. You have to look there and make sure the maximum size is allowed there. But as far as videos go,
and the MIME type.
The MIME
so
type, yes.
That's the other thing. A lot of times with your talent acquisition module, you want to limit those MIME types to documents, PDFs, potentially Excel spreadsheets, because you don't want somebody from outside your organization loading anything that could corrupt your environment. Yeah. You hopefully trust all of your employees, but if you do want to limit it and say, okay, they can post JPEGs and GIFs, but they can't post videos, because you don't want to either have anything in danger, or maybe you just don't have the bandwidth space to put a lot of video logs. You can limit the video and then have them email that to you, and you keep that. You can still attach it yourself, but at least you know it's a safe attachment to put in there.
We have one more question. Do I have to enter one employee event at a time, or can I enter hundreds of flu shots to a group of employees quickly? Yes, you can mass assign health components and health series to employees. I did not mention that earlier, but you do have the capability to mass assign.
And if you do get a list, you could just use the spreadsheet designer. So you would basically, quick, easy way is pull a report from what's in there, and then move that to CSV, export to CSV, and then go ahead and create your spreadsheet, because it'll already have everything in the correct format, and do an upload. Same like Microsoft add-ins, where you use the upload wizard and upload it back into there. If you happen to have like a spreadsheet from a medical provider that everybody went to and you didn't track it yourself.
So I want to thank you guys for a great presentation. I want to thank you for attending.